They want to know what is the survival among children or when they become adults who have sickle cell disease. I personally have met an 80-year-old sickle cell disease patient. But what does your experience or the literature say? What is the survival? How is it like among children who have sickle cell disease?
Okay. So previously, sickle cell disease was considered a kind of a death sentence among children and adults. But with improvement in early diagnosis and also with comprehensive healthcare plan and so many interventions, especially the infection prevention measures, all children who are diagnosed with sickle cell disease, they are started on penicillin B prophylaxis that improves their survival during and prevents them from getting complications from severe infection. So such measures, other follow-up measures, people do, we do routinely conduct something called transcranial Doppler to assess the risk of stroke in children from 2 years to 16 years. So such comprehensive healthcare plans have actually reduced the mortality or the death death rate from sickle cell disease in children almost to half. Previously, it used to be said from up to 1995, if 100 children are diagnosed with sickle cell disease, only about 50 to 90 children live to see their 5th birthday. But nowadays, for the past 10 to 20 years, for the past 2 decades, it's been encouraging in children, especially their improved survival because of all the preventive strategies that we are incorporating.
So at this point, we can say that it is a myth. It is a myth that children with sickle cell disease do not live beyond 24 years. It's a myth because, as you are trying to explain now, there is comprehensive care. Provided you are diagnosed, then you can access that comprehensive care. Because then if you are not diagnosed, you can come in very sick. And when sickle cell patients are very sick, it's a bit tough, especially if you don't know that they have sickle cell disease, if it takes you some time to get to know the diagnosis. So right now you're saying it's a myth. Sickle cell disease patients live beyond 24 years. And tied to this question, which you have already tried to answer, is that those who live long, what is the game changer for them? What things make children with sickle cell disease grow into adulthood, have productive lives? And this one, I would like you to take your time and take them one by one, because most parents who have joined because they want to know what they can do for their children. So let's talk about how parents with children who have sickle cell disease, now that you have said it's a myth, they live to adulthood, they live to ripe old ages. What can the parents do for them? Not only for them to live, but also to take away their pain, because you can live, but you are in so much pain all the time. So you take them for us one by one, and then let us understand.
Sure. So the first thing is to know that there is a problem, right? So early diagnosis is key. I will hammer it again and again, early diagnosis. So we might not have that logistics, that sort of infrastructure, and then the financial logistics to have a mandatory newborn screening program in all the babies who are born. But there should be an increased health awareness among public and also among health workers, so that any child who visits the hospital for the first time during any blood draw, there should be an opportunistic way of doing the screening for sickle cell disease by doing electrophoresis, hemoglobin electrophoresis, not sickling test. That's number one. So once a child is diagnosed, then that child should be enrolled in a comprehensive healthcare plan, preferably a pediatric sickle cell disease clinic, or even if there is a primary health center nearby where it is manned by a health worker, even a CHIPS compound should be made aware of standard guidelines on how to follow up, to do routine examination, growth assessment in those children diagnosed with sickle cell disease. So the second is the enrollment of these children with sickle cell disease, newly diagnosed, into a comprehensive healthcare plan. And into this goal also goes counseling of the caregivers, because it will be very, very tough for a parent to accept that his or her child has a chronic disorder such as sickle cell disease, and that could be really devastating for many, especially those diagnosed in the very young. They actually fail to believe that this bouncy baby in my hand has something like a sickle cell disease. So a vigorous, repeated, reinforced counseling is important for the caregiver so that they are compliant with the comprehensive healthcare plan. And the comprehensive healthcare plan also includes starting of something called micronutrients or vitamins. Usually those children with sickle cell disease, because of their rapid breakdown of their red blood cells, they tend to have something called a folic acid deficiency, which is important for making of the red blood cells. So we start them on folic acid and zinc, very importantly, zinc. Zinc has been found
So
to...
at this point, just hold on, Suda. You have said that the game changer for the children to make them live long and also not to have pain, first is that you need to know there is a problem. So therein comes early diagnosis. So the first time any blood is being drawn for your child for any test, hemoglobin electrophoresis to determine whether the child has sickle cell disease should be done. And then if the child does have sickle cell disease, you said that counseling of the parents should be done. Very important. What to expect? What is this? And who has given it to the child? Because normally we want to know who has given it to the child. Is it the mother? Is it the father? We want to know. But you've already told us it's the two parents together who have given it to the child. It's not one parent. Then you enroll that child into a comprehensive care program. The comprehensive care program, you have mentioned infection prevention from right when they are diagnosed till about age 5 years. We put them on prophylactic antibiotic, which means that the child is not sick, but we are giving them antibiotic because we anticipate that that child could come in touch with a germ. And because the child has sickle cell disease, that germ can harm the child. So we give them antibiotic. And then you said they also need micronutrients because of the sickle cell disease. They tend to lack folic acid. And then you mentioned zinc. So because we are supported by Zincovit, who has promised to give us several packages of Zincovit, the drops, the syrup, and then the tablets. I would just like you to tell us what zinc does for a child who has sickle cell disease. Okay. We have some questions, but we will take the zinc and then we'll get back to the question.
Sure. So as we all know, children with sickle cell disease, they are at risk of infections because of the body's polycystation. Spleen is not receiving enough blood supply, and also they tend to break down their red blood cells because they are quite flexible. They cannot pass through the small blood tubes. So what zinc does is, number one, it sort of modulates the immunity, it boosts the immunity of these children who are relatively, whose germs, fighting against the germs is compromised, right? So it boosts the immunity of these children because of their relative lack of immunity against certain germs. And also it prevents these children from breaking down their blood cells, okay? So when these children do not break down a lot of red blood cells, then there is a little bit of reduction in the compromised growth. So once the blood flows freely without without clogging, without breaking down, then these children grow better. And this research has been found that previous studies have found that children who have been on zinc up to the age of 5 years, the death rates have significantly reduced. And also zinc will help these children from having their airway and their I don't know how to say gastrointestinal, their intestines and their airway, the breathing tubes, they all are well organized so that these children do not get infections from these because of zinc deficiency. So zinc definitely helps to reduce infections, improves the immunity, and also helps reduce the breaking down of red blood cells.